Welcome back to Primetime. I'm Nick Kalsis. I'm here with Todd Sauter and Dr. Peter Weber. We were talking about that the length of time that someone might have a deteriorating condition with their hearing can be over a prolonged period of time. What do you think a good age is for someone to come in and have their hearing tested? Is there a good age?
Well, any age really is we, even in children, of course, we're constantly screening their hearing even at birth to make sure there's no problems there.
Yep.
In the adult, population, we know that hearing loss is going to be more frequent as you get older.
Right.
Certainly anyone over the age of 40 to 50 should be having their hearing tested at least once to get a baseline to see where things are.
So
there.
let's say someone comes in, they're 50 years of age. They come in, they have a hearing test to establish, as you say, some sort of a baseline. How often should they come in?
That usually depends on the type of hearing loss that we see.
Okay.
So if a patient comes in and there's no hearing loss, they don't have any complaints, you're probably going to let them go a lot longer, maybe 5 years or so, 10 years. If they're starting to have what we call presbycusis, which is hearing loss due to aging, and you see that more in the high frequencies, we'll usually have them come back on a yearly basis. And depending on how bad the hearing loss is bothering them, whether they're at the point where they need to be aided with a conventional hearing aid or some other type of assistive device to help them with their hearing, they may be tested even more.
So, presbycusis, did I say that right?
Presbycusis.
Presbycusis. I was close though, wasn't I?
You were.
It literally means old hearing, if the translation.
When I think of hearing loss, I think of someone in a war, bombs going off, loud sounds. I think of concert and someone playing guitar right in front of the monitor and blowing their hearing out. But now I'm hearing that because of old age, over time, someone's hearing can begin to go away.
Absolutely. We're all pre-programmed to lose our hearing. And if we lived long enough, we'd all lose it. Everybody's going to lose it at a different rate and at a different time. The
hearing process.
Yeah. So what happens is that there are two ways we hear. One is conductive, meaning that the sound gets to the inner ear.
Yeah.
The other is sensorineural, and that's where the little nerve endings within the inner ear take that sound and send it to our brains. And it's those little nerve endings that over time die, and they die at a different rate for different people.
And those cells of the inner ear are the most fragile part of the system. Those same cells are what deteriorate in time. Those same cells are those that are damaged by loud noise exposure. Those same cells are those that are damaged by certain medications that people can take.
Right.
Often hearing loss comes about by a combination of factors over someone's lifetime rather than just one single cause.
Are there things that you can do to help reverse someone's hearing loss? Do you get faced with that question a lot?
Unfortunately, the most common type of hearing loss is the sensorineural hearing loss. And unfortunately, in mammals like ourselves, the sensory cells of the inner ear do not regenerate.
Okay.
And so once they're lost, they're lost. And so when we're talking with younger people in terms of teaching them to protect their ears from loud noise exposure, that's a point that really needs to be made, is that once those cells
are gone,
they're
gone.
You've got a permanent hearing loss.
Okay. What can you do? What can be done? Someone comes in, they have a hearing test, there is hearing loss. What kind of assistance can you lend to these people that might have a hearing loss?
Right. So because there's no direct medical treatment for hearing loss, we rely upon technological solutions to cope with the effects of hearing loss. The most common are hearing instruments, are hearing aids.
Right.
Small, now very advanced computerized electronic devices to help make up for some of what's being lost by the hearing loss. Many people still are afraid of the stigma of hearing aids, and that it is something that looks ugly or looks old or something that people don't want. Where more often now when people get a hearing instrument and they realize how small, how inconspicuous it is, why did I wait so long?
And there are different kinds of hearing aids to begin with, right?
There are many different kinds, and these days there are really two camps. I've got people that get hearing instruments that are very gadget oriented. The most modern hearing aids now are designed to communicate with your smartphone, get a direct wireless signal from the television, working with the wireless technology for those that are really into the gadget aspect and really like that. There are also hearing instruments. This is a device called the Lyric. It's a hearing aid which sits very deep into the ear canal. That's got a battery that lasts 3 or 4 months at a time, and it stays in your ear 24 hours a day. So for those that think, well, I don't want to have to change batteries, I don't want to have to clean it, I wish I could just have something that made my hearing improved all of the time, there is something like that. So you can make a hearing instrument very...
Does it feel funny? Like when it's in your ear, does it take some period of time to get used to?
There's certainly usually an adaptation period for any type of hearing device, whether that's the Lyric or anything.
And that's in the canal, like
Correct.
There's nothing outside the ear, no one would see anything, is that right?
But even those that have something outside of the ear are so small now, very rarely is that even seen. Very common for me to have a patient who is very concerned about cosmetics. Then once they get the instrument and they're happy, they end up taking it out and showing it to all their friends. And so they go from being very worried people are going to see it to showing it off and showing how small it is and what it can do.
Do you guys use the big hearing aid? What I hear people call it like the banana hearing aid. Is that in use anymore or not?
It can be for certain patients, but it is not the norm. It's for patients that really have almost no hearing whatsoever. Okay. It's a very powerful hearing aid. We typically use it more in children, actually, prior to them going on to a cochlear implant.
And how does that work?
The same way as the other hearing aids do as well. It's an amplifier. So it basically, what a hearing aid does is it makes the sound louder, in simple terms. It's just how big it is means it has more power. So it's like cranking up the volume on your TV in a simplistic manner.
Okay. Well, we're going to have to head to another break right now. One of the things I heard that, was kind of a surprise to me was that hearing loss can affect dementia. And I'm not quite certain if maybe I heard it backwards that dementia affects hearing or maybe hearing affects dementia. But in any event, when we come back, that's one of the questions that I want to ask and have you answer for me.
All right.